Hi everyone. For this presentation, I'll be discussing infertility. The group proposal I've created is designed to address the emotional consequences that it has on individuals and couples. The goal of the group is to increase the understanding and emotional and psychological impact of infertility that it has on couples that have sought but are unable to conceive. A second goal will to learn to help couples work through their feelings of loss, mourning, and also the shame surrounded with the diagnosis of infertility. Um, it will also help couples recognize and cope with common problems arising from this, such as marital dissatisfaction, sexual dysfunction, loss of spontaneity, and the increased conflict. It will also help explore ways to help infertile couples reduce the feelings of isolation from each other as well as families and from their friends. As we know, a growing number of couples in the United States are facing the great disappointment of infertility. This can place an enormous strain on even the healthiest relationships. Um, the inability to have a child forces family or couples, to confront the most basic assumptions about family, parenting, children, and even gender roles. A little background information. Infertility, according to the American Society of Reproductive Medicine, is a disease of the reproductive system that impairs your body's ability to perform even the basic functions as reproduction. Impaired fiduciary is the ability to get pregnant or carry a baby to term, and this affects at least 1.7 million women ages 15 to 44 in the United States. Infertility, on the other hand, is is defined as the ability to get pregnant after at least 12 consecutive months of unprotected sex with a husband. About 1.5 million married women in the United States are infertile. Infertility is not limited to female population and affects both males and females. About one-third of infertility cases are caused by women's problems. Another one-third of problems are due to demand, and the other cases are caused by a mixture of both male and female problems, but they're unknown. Um, besides these physiological problems, infertility can cause multiple effects on your emotions or psychological effects. The stress of not being able to conceive can lead to anger, depression, marital problems, sexual dissatisfaction, and social isolation. Parenthood is thought to be a major transition in adult life for both men and women. Um, when you're not able to conceive, it can cause some marital discord, especially when you're forced to make decisions about medical procedures. Both men and women can experience a sense of loss of identity and have pronounced feelings of defectiveness or incompetence. Um, Studies indicate the emotional stress and marital difficulties are greater in couples that are infertile. Um, and the faults or men usually feel a lot of this effect, or I'm sorry, when the men is at effect, then it's usually more pronounced. But however, women show greater levels of distress than their male counterparts. The purpose of my group is to provide counseling and guidance for these couples that are infertile, and helping them maintain a healthy marriage. Um, the assumption that people can get married or get pregnant after they're married is false. Um, there's so many people that can't conceive, and the problems associated with your partner or can just cause so many problems. Um, it can make your marriage go stronger, or it can make it fall apart. This program is to help people address different aspects of infertility and the implications it has on the relationship. The framework is largely based out of psychotherapy. There are different therapy techniques that will be used. The cognitive therapy will be addressed, narrative therapy, constructivism, as well as person-centered therapy. Cognitive therapy has been used to help with couples counseling. It's been shown to be effective for addressing problems dealing with dysfunctional emotions, behaviors, dysfunctional cognitions, and this therapy will help couples that are trying to conceive that are unable to change those patterns that might be irrational or destructive. These patterns can very well be distorted and affect a couple's relationship. The goal will be to help with introducing different techniques such as relaxation training, a little bit of restructuring, and eliminating those negative automatic thoughts and attitudes towards infertility. Narrative therapy will be used in the form of externalization and be used to help couples working towards to decreasing um, the self or the irrational importance of infertile problem. Um, People might have you know problems with their identity with the introduction with infertility in their lives. Um, People might conceptualize this as an internal problem. The goal of the narrative therapy was to externalize that and look at infertility as an adversary, an external adversary, with the intention of helping the couples join together and forming a partnership. Constructivism will help with the mourning and loss of not being able to have a child. Techniques that may be used would be imagery, journalizing, and externalizing the problem. When you've been diagnosed with infertility, you might have make a sense of loss. This will help them in the grieving process. It will help them challenge and reorganize and develop a new sense of reality. Lastly, person-centered therapy will be used. It will provide an environment that provides empathy, acceptance, and congruence, and hopefully foster an environment that will allow them for growth and change. The goal with this will be to help people discover that they have their own solutions, to solve these problems. The membership will be limited to heterosexual married couples between the ages of 20 and 44. They must be newly introduced with being infertile and and be referred by a physician. They must be willing to commit to at least 12 sessions and be willing to share their experiences with other couples. Each group will meet for an hour, and each session will be discussing a different topic. The first one of these topics will be to get to know each other. We'll talk about the aspects of infertility, the psychological aspects of infertility, managing stress, when to seek help, such as IV treatments, learning to support each other, counseling suggestions on how to keep your marriage intact, talking about sex and how it's affecting your marriage, talking about grief and depression, also recognizing signs that your marriage might be in trouble. Also, when is enough enough? When are you going to stop trying to conceive and getting pregnant? Realizing that adoption might be an option. And the last meeting will deal with your final thoughts and feelings about infertility. Various techniques, like mentioned before, will be used. We'll be talking about and questioning your cognitions and assumptions about infertility and challenging your beliefs. Also, practicing relaxation, being mindfulness, and distraction techniques will be used. A depression inventory and a marriage questionnaire will be given before and after the sessions, and this will help us determine whether or not the group counseling sessions were effective. I think this group will be very useful for people that are infertile. I know that it's a problem that it's growing in the United States, so hopefully it will be effective, and the techniques will be used to help people reduce the stress and the problems associated with infertility. Thank you.